We all know someone that has faced addiction at some point in their lives, and we are here to offer a solution for that problem. It is on the rise, and something needs to be done about it.
The Center of Excellence in Addiction Medicine was created to allow us to offer quality addiction care to all patients who present to Baptist with substance use disorders.
The field of addiction medicine is a new field, and there needs to be standardization. It also needs to be a medical model. It needs to be academic. We want to use the latest research. We want to actually generate research. We want to be innovative in the approaches and how we care for these patients with substance use disorder.
So as a telehealth administrator, I'm the first point of contact for any of our entities when they request a new service. So if they determine that they want to have addiction medicine program at their entity, they contact me, and then I start the process. I get the ball rolling.
We're doing this video so that everyone knows how they can access the telehealth consult service and offer the best quality care to our patients for addiction medicine.
The first step of the process is identifying the patient that needs the consult. After the physician sees the patient, then the physician will enter the order consult addiction medicine into Epic. The nurse or the secretary will then contact the fellow, and there's two different ways to do that. If there's a stat order, like in the emergency department, the nurse will call a cell phone. The fellow that's on call carries the cell phone 24/7, and they answer it immediately when it's called. The other way would be for a routine consult, and on the routine consult, they call the office and they leave a message with the answering service. Once the secretary or the nurse contacts the fellow, they determine which fellow is on call at that time, and they enter that physician's name into our system. This is very important because then the patient goes on this physician's rounding list, and that way they can identify the patient and easily find the patient in the system. At that point, the addiction medicine physician or fellow would then ask to speak to the ER physician to get some background on the patient. While the physicians are talking about the patient and discussing the need for the consult, the nurse would explain the process to the patient and or the family and get consent, as well as get the mobile cart so that the consult can take place. So once the cart is positioned in the room and the consent form is signed, the nurse introduces the patient to the fellow so the process can begin. The fellow assesses the patient and determines the treatment needed based on their assessment. There's typically two options for that as well. They can recommend outpatient treatment, which at that point the fellow would enter that into Epic so that it shows up on their after visit summary when they're discharged, or they can recommend inpatient treatment, and then we have peer support specialists that will help bridge the gap for that as well. Once the assessment is complete and the treatment is determined, the fellow will enter that information into Epic, and they will have a conversation with the entity physician as well. So while the physicians are having that final conversation, the nurse would take the mobile cart back to the location where it is stored. It's very important that the cart be returned to the location and plugged in at all times so that when the next patient needs this service, that we're able to provide that service in a timely fashion. There's a Center of Excellence Addiction Medicine champion at each facility if you have further questions.